Save the economy or save lives? That's the key moral dilemma facing officials as they weigh which steps to take next in response to the pandemic. President Trump is eager to restart the economy, but medical experts warn if the U.S. moves too quickly, more lives could be lost. The New York Times held a video conference with 5 experts from different backgrounds to discuss the difficult decisions that lie ahead. Prominent political activist and Reverend William Barber took part in that discussion. And he joins us now from Goldsboro, North Carolina. Reverend, thank you so much for waiting. This pandemic has led to an unprecedented national emergency. What do you believe the moral response should be?
Well, thank you so much for having me on. And what we have to know first and foremost is that pandemics exploit the fissures and the breakages in society, the inequalities. And America has a lot of wounds in that area when it comes to poverty and racism and structural issues. And what pandemics do is they exploit that. When you don't close the fissures, you deepen and expand the life of the pandemic. So the moral issue is that before the pandemic ever happened, we had 700 people dying a day from poverty, 140 million people poor and low income. After the pandemic, the immoral thing we have done in the Trump administration, McConnell has done, is they pushed for a bill, 3 bills, gave $2.5 trillion to corporations, and gave the people crumbs. And so what is happening? We have folk with no paid sick leave. We have people that can get tested, but they don't have any free insurance. We don't have a guarantee that they can have their rent paid or that the water won't be shut off. So we're actually in the midst of this pandemic deepening the inequalities. And when you deepen the inequalities, you actually empower the pandemic.
Indeed, poverty was the pandemic before this pandemic. Reverend, our own Paula Reed, who works in Washington, asked advisor to the president, Kellyanne Conway, about why there was such a lack of diversity on the president's council to reopen the economy. She didn't have an answer for that. And we're hearing more and more about how minority small businesses are really challenged when it comes to accessing a little bit of these billions of dollars that have been set aside to help them stay alive financially. Is the government doing enough to ensure that all Americans financially survive this pandemic?
No, and they weren't doing enough before even the pandemic. There was no diversity. As I said, there were 140 million poor and low-income people before this pandemic. 61% of African Americans are poor and low wealth, over 26 million people. Now, don't forget, 66 million white Americans are poor and low wealth, but also 54% of all people making less than a living wage were people of color. This president, this administration has dismissed that. He brags about what he's done for the African American community, but actually wages have gone down and people are in low wage paying jobs. They may have jobs, they're low wage paying jobs before the pandemic. After the pandemic, his administration has not done anything to really reach the African American community. Before you get to businesses, the fact is, one of my friends says, Black people are dying the most and being tested the least. We are seeing over and over and over in communities that you're having the highest rate. I think in Mississippi, 70% of those who died are African Americans. That's because of structural racism. And what does his Surgeon General say? Black people need to stop smoking, stop doing drugs, and stop doing alcohol, and does not address the systemic realities of the lack of health care, the lack of hospitals, the lack of treatment, and the lack of testing, which are the structural issues. If anything, this administration is widening the racial gaps and creating more harm than is creating good. We had a conversation yesterday with clergy, and the clergy across this country rewrote an open letter to the president, the vice president, the task force, the surgeon general, saying, listen, we need hospitals in communities of color. We need testing sites in community of color. We need a Defense Authorization Act to make these masks and ventilators so that people can't price gouge, and we can get those things to our community. We don't need a lesson about personal responsibility, which is always the way some people try to dismiss dealing with structural realities of racism and poverty.
And Reverend, those points are really important to those points are really important to highlight because, as you say, there are deeper rooted issues that has sort of been exacerbated by this pandemic. For example, we know that people with asthma can be severely affected by COVID-19. A lot of Black and brown people live in communities that are close to highways, and so that will have an effect on asthmatic conditions for a lot of people. A lot of Black and brown people, a lot of immigrants are those front-facing service workers that we rely on, those of us who are all working from home. And it's easy to say to people, Netflix and chill, but for a lot of people who need that paycheck, the bus drivers, the postal workers, the bodega owners, they are going to work every single day, and they are coming into contact with people who may be asymptomatic. And so these are some of the issues that are sort of coming to light, even though Black and brown people knew those issues existed before COVID-19.
Exactly. You remember some time ago, Trump said, for instance, the war on poverty was over. As I said, while we sit here, 43% of our country is poor and low wealth, and 61% of African Americans were poor and low income. And it's not because people were lazy, it's because the jobs were not there, particularly high-paying jobs. But there's a couple of things you just mentioned. The Surgeon General the other day said Black people need to stop smoking. The majority of smoke that Black people inhale comes from plants. Black and people of color community being close to plants that are emitting toxins in the air, like in St. John's Parish in Louisiana, that has the highest per capita rate of death in the country before the pandemic, and now still has the highest rate of death from the pandemic. Those people there have asthma and other diseases because of the carcinogens that are produced by the plants in Cancer Alley. That's an issue that we have to do, and they're not getting help. We call people essential workers, and many Black people are among the orderlies, the grocers, the fast food workers, the nurses, and whatnot, who are essential workers. But let's get broader than just Black. We say people are essential workers and they represent the soul of America. Well, when are the essential workers going to see the soul of America? We tell them to go to the front line. We don't guarantee them health care. We have not guaranteed them sick leave. We have not guaranteed them a living wage. We've done all those things for the corporations. We bailed out them before there was even a full-blown pandemic, but we've left these essential workers without assistance. And we have to come to a point to realize everybody has a right to live. If they don't, we don't. If they are sick, it's not going to stay among the poor and low-income workers. If Black communities are sick, the germ is not going to stay there. If Latino communities are sick, it's not going to stay there. It's going to continue to spread and extend the life of this pandemic to the rest of us. It's one of the reasons we've been quoting a scripture in Isaiah that says, "Woe unto those who legislate evil and rob the poor of their rights." We are seeing a robbing of the poor and low-income people of basic fundamental human rights: the right to a decent wage, the right to health care, the right to sick leave. And in a pandemic, those things hurt us all. Prior to a pandemic, you might be able to hide it. During a pandemic, it will be exposed, and by those things continuing to exist, it will extend the life of the pandemic and its impact on society. So everybody has a right to live. If they don't, we don't, and we better hurry up and realize that, and this administration better realize it.
Reverend, I think almost every other day I hear about somebody either passing away or testing positive for COVID or in the hospital in sort of my general circle, not my immediate circle, but it may be sort of the circle around that. And I was thinking yesterday when I heard about a 51-year-old dying that there is going to be sort of a physical hole in so many families, particularly Black families, once this whole thing is over. People who we expected to be there next month who just no longer exist, right? They're physically gone. But everything that they have to offer is also physically gone, whether it is their wisdom or their financial support or physically being there to care for children, if it's a grandparent. Just a bit of sort of the long-term impact. But when everything, quote unquote, gets back to normal or the new normal, what are your concerns about the long-term effects when we're talking about minority communities?
Yes, and I hope we never get back to normal. Because, as I said, normal was 700 people dying a day from poverty, 250,000 people a year, and we didn't call that a national emergency. We didn't address it. That's one of the reasons we're in the problem we're in now, because of all the fissures and wounds that were opened that gave entry to this pandemic. The pandemic didn't cause the disparities, but it's exploiting them. You know, I'm a pastor. Just last night, I was talking to a family in my church who's had 10 people that have either died or have COVID-19 or either are in the hospital right now. 10 in one family. 10. This couple has 10 people. I've had a number of family members that have had church members that have had at least 3 to 4 people die. And there is going to be a deep hole. There's a deep pain. That's one of the reasons why we're trying to address that now in preaching and being in community, virtually and social media. But you know, I'm also hearing something else. I've heard a number of those people say to me, my loved one will not die in vain. They said, this is not the act of God. This is the act of humans. This is the act of a government. They agree with the Boston Globe when they say the president has blood on his hand, and those who've gone along with this and did not do the things that they should have done. The senators that took time when they heard about this to move their stocks around rather than raise an alarm and care for the people. And so they are saying to me, Reverend Barber, we have to come out of this pandemic better, and we have to change this society. If folk had to die, if people had to be crucified, referencing Easter, then we need a resurrection of a movement. On June 20th, 2020, we're organizing the biggest, largest gathering of poor and low-income people, moral leaders, and advocates. We had already planned to do it before the pandemic, but people that have lost members of the family are saying we have to do it now, and we have to drive the consciousness of this country in a new direction. I have a lot of friends, as I said, they see what is happening here as crucifixion in real ways, things that didn't have to happen. It's man's inhumanity to man, as one philosopher said. And they're crying, but through their tears, they're saying, we're going to fight for a better society for our children, because none of us know. We could be 48 hours from death. 48 hours, you could be in crisis. And so one of the things we've been asking is, if you knew you only had 48 hours to live, what kind of life would you use your last breath to fight for? What kind of world would you fight for with your last breath? What kind of love? What kind of mercy? What kind of grace? What kind of health care? What kind of living wages? What kind of government? And people are saying, you know, that's the question. And if we survive this, then we're going to use every breath we have to make a difference. And in some ways, that gives people hope in spite of the despair, when they know that their family members that have died can be honored if we, in fact, come out of this pandemic and fight for change, that this never, ever, ever happens again like this.
Well, Reverend Barber, that is some profound stuff right there. That is a hell of a question to ask oneself, if you forgive my language, Reverend. Really appreciate talking to you. Let us hope that the new normal does turn out to be better than the old normal. If anything good can come out of this pandemic. Thank you so much.
Thank you so much, and God bless to you.